So pregnancy is a continuous process, although it's classified into 3 trimesters, just for ease of management and understanding. Now, if you've had your NIPT screening test done, I'm sure you're going to go back and find out what you're having and if everything is okay. Make sure you do have an early anatomy scan performed as well to make sure that the baby structures are all going good. Yes, the development is not complete, but we are able to see some major abnormalities which may trigger or alter the course of pregnancy and management. So it's advisable to get an early anatomy scan done as well. Now we're going to talk about what we call second trimester. Sometimes there can be ongoing symptoms that you faced during the first trimester, like your nausea, vomiting, but generally that will settle down. Now, as mentioned in the preconception video earlier, just make sure you also continue to take your supplements. Discuss with your healthcare professional regarding your iron and vitamin levels, and make sure if you need any supplements, you're continuing to take that as well. So in terms of the nutrition exercise, I have already made a playlist for you to go take a look. So go take a look at it, because the preconception first trimester care, the advice will pretty much be ongoing throughout the pregnancy as well. So definitely go have a look at that link that has been provided for you. So generally the second trimester is when you kind of tend to settle down. There will be an assessment that will be done in terms of your general health. Remember, every visit you have with your healthcare professional, your blood pressure will be checked and the urine will be checked for sugar and protein. So that's a routine that we provide for all pregnant women by all healthcare professionals as well. So make sure you do have that performed as well. In terms of the symptoms, like I mentioned to you earlier, some of your morning sickness symptoms will settle down, or some women may continue to experience that throughout the pregnancy as well. Now, the most important things that are discussed in this trimester would be what we call the fetal anatomy or morphology scan, and then the option for you to have your vaccinations performed, which is recommended by the Australian government. There's lots of misconceptions about vaccines that's going around. I'm not going to get into that. All I'd encourage or advise you is that you speak about your concerns to your own healthcare professional, but this is the recommendation that is provided by the Australian government free of charge to all pregnant women, to provide fresh set of antibodies to this baby that will cover them for the first 6 months of their life, because pertussis and flu does not have any treatment except supportive therapy. So unless you've seen a baby struggle with it, it is heartbreaking, which is why we encourage you to get it done. But at the end of the day, it is your choice. So go do your research and discuss that with your own healthcare provider as well. Now, what happens in the fetal morphology scan or anatomy scan? Provided so far your pregnancy has been progressing well and your early anatomy scan or your first trimester screen is all good, you'll be scheduled for this particular scan between 18 to 22 weeks. What is being analyzed is really important. We look at the gross anatomy or morphology of the baby from top to toe. Every organ is analyzed because the development is nearly complete. There are some conditions that will continue to evolve. So to the best of the knowledge and the technology that we have, we can tell you if everything is going okay or not. So baby's morphology is addressed or looked at, and then the placenta position, the fluid around baby, and the most important thing is the preterm birth prevention, the link of which is provided underneath, is also followed, wherein the cervical length will be measured. So this is the standard of care that we provide here in Australia. And I think the world over this is being followed in most countries as well. So this, you can ask your sonographer when the ultrasound is being performed if you would like to know the gender of the baby. I know some countries it is not discussed, but that option is available to you here in Australia as well. Once your scan of this is done, then you go back to your own healthcare provider to discuss the results. Make sure that the growth is okay, the morphology is okay, the placenta is all good, the fluid around baby is good, and cervix is long and closed. So that kind of comprises your morphology scan. Now you will also be encouraged to get ready to have the check for diabetes. Again, speak to your own healthcare provider if you've got any concerns with that. I'm just only talking about the recommendations that is being offered. For the diabetes, the check is generally between 26 to 28 weeks, provided there is no pre-existing medical issues or there is no family history, in which case you would have had the test done earlier. So again, please speak to your own healthcare provider. So this is a gist of what can happen in the second trimester. We have spoken about first trimester earlier, so if you'd like to go and have a look at that, that would be great. We will be releasing a video on the third trimester very soon, so you can subscribe to our YouTube channel as well, or visit our website at www.athenawomensclinic.com.au. I'm Dr. Kavipriya Soma, a GP with special interest in women's health. Thank you.